meninges are shining.
Your meninges are shining.
That would be a good pickup line, huh? Oh my
I
God.
like your
Here's some shiny
meninges. You
meninges.
got nice meninges. I'll take this off. Put that down there. All right, so we're gonna work on the meninges. So step number one is we calibrate. Show me yes, show me no. Permission to learn, permission to work on the meninges. I've got the permission, that's good. All right, so now we're just working on these meninges, okay? So you wanna ask, a good way to navigate would be, if you wanna use two quick navigations, and I got it over here, is it the vertical membrane system or is it the horizontal? That'd be a quick navigation, wouldn't it? So, show me yes, show me no, good. Is it the vertical membrane system that's the priority? No. Is it the horizontal? Yes. So now we've just ruled that out and we're just here in this horizontal aspect. So now when you look at it, what kind of question would you ask next? Is it the left side or is it the right side? Okay. So is left side the priority? No. Is right side the priority? Yes. Okay. So now we've eliminated all of this to just this right side. And we would say what? Anything more? Anything more? Yes. Okay. So what would be anything more? Anything more could be, I could put a line like this and I could say, is it behind this line? So is it behind that line? No. Is it in front of this line? Yes. So I'm dealing with tension here in the front. Anything further? Yes. So it wants me to be even more specific. It's saying it's not all of this, it's a certain portion. So what I'm gonna do is I'm just gonna do a scan and I can see it's right there precisely. That's where the problem is, right there. So it's right here. Okay? So it's as it's approaching, you know, the sphenoid. So right in here, okay? So what I'm gonna do is I'm going to see, you know, where is that manifesting? So that tension in the body, is the tension in the body in the cranium that I can evaluate? Yes. Is it anywhere else? No, it's mainly in the cranium. So I can say, can I evaluate, is the face gonna be, no, cranial base. So I'm gonna evaluate the sphenoid. So I'm gonna stabilize the occiput. Sphenoid moves to the left, doesn't move to the right. So we have a block there. And let's see, I'm gonna come back here to her temporal bone and it's totally asymmetrical. It's like this. And it's stuck on both sides. So that's stuck. Should I evaluate any further? No, it says that's gonna be enough. I'm gonna get you to verify this. Our cranial expert here. So sphenoid basically moves to the left, but does not move to the right. The temporal bone's asymmetrical and both sides are kind of stuck. All right, so let's see. Is positioning a priority? No. So we can just treat it in this position. So I'm gonna use this as a focusing tool. You know, I'm gonna put it here. Nope, doesn't want me to do that. It wants me to put it over here, okay. And you're gonna tap when I tell you to. So I'm focused right just on this area there. So I'm gonna pull out that hologram. So I've got it here. You can begin to tap. So as I'm looking at it, what am I in right now?
Hold.
No, hold space.
Hold space.
And now it's starting to what?
Mold.
Hold, very good. Now it's stopped, what am I in?
Holding.
Hold space. Still wants to do something, so I'm in hold space because something's going on there. Something's going on. There it goes. So the pressure is just building up and then it just, all right, you can relax, breathe in and out. And breathe in and out. Good. And breathe in and out. And breathe in and out. Good. And relax. So let's reevaluate. That moves even better to the left. Just melts away. You're gonna like this to the right. So sphenoid released. I'm gonna come to the temporal bone. Let's see. Right side released, but left side didn't. So there's still more. So you have a feel. This is what I love doing. This is fun. Because you're just like a Rubik's Cube, you're trying to figure out what's going on. That sphenoid released nicely, right temporal did, but left is still hanging on, so that means there's something else going on.
Mm-hmm. Yeah, left is
Stuck still. Yep. All right. So, what I'm going to say, is this still a priority? No. Is the tentorium still a priority? No. Remember, that's the last area I was in. Are the meninges still a priority? Yes. Okay, so I'm in the vertical, right? In the vertical membrane. So if I'm going to navigate through this, all right, I can break it into sections, can't I? What are they? They would be the falx cerebri, falx cerebelli, and the dural tube, right? Dural tube. Those are three things I could ask. So I could say, is the dural tube a priority? No. Is the falx cerebelli a priority? Yes. That was interesting. Falx cerebelli. So she's into these little minutia stuff, right? So it's something deep in here. So this falx cerebelli, so in between the cerebellums. Anything more? No, it means I'm just going to work on that whole thing. So I'm going to use this as a focusing tool so everybody can see this falx cerebelli. So right in here. So it's just, it separates the left and right cerebellum. So I'm going to put it like this. That's okay. So I've got a focusing tool. And I'm going to go in there and take that hologram out. So I've got it. All right. So what am I in now? Start tapping and breathing. Good. That's it. So breathe in. So now it's, see how sometimes it's just hold space. I'm just, even though I'm listening, that's all it wanted to do. And down. Breathe in. And down. Good. Breathe in. And out. Good. Put this down here. There we go. There it goes. Very nice. So that's moving beautifully. Come in here. That's good. That's good. Good feel. And it doesn't mean I don't do cranial work anymore. I would probably finish the treatment by integrating, by working on those cranial bones. That's how I would integrate back into the system. How's that feel?
Yep.
Did you feel anything as we worked on that?
I felt my whole head was kind of wobbling back and forth, and I wanted to say it was probably a windshield that you found in there.
A windshield. All right. Thank you. All right. So here's what we're going to